Recovery time after Brazilian butt lift can vary depending on the individual case and the patient's overall health. Typically, it can take approximately 6 weeks to recover from a BBL. The first 2 weeks, you will need to avoid sitting and laying on your backside. Most patients can begin light activity in 7 days, but to do advanced exercises, you have to wait until 6 to 8 weeks after surgery. Typically, I advise to avoid sitting or lying on their buttocks for at least 2 or 4 weeks after the procedure. During this time, you will need to use special cushions, such as a donut cushion, to avoid putting pressure on the buttocks when sitting. After the first 2 to 4 weeks, you are allowed to sit for brief periods of time. But it's still important to avoid prolonged sitting or lying on the buttocks for several weeks to months after the procedure. I generally recommend avoiding hard exercise for at least 2 or 4 weeks after a Brazilian butt lift. This is to allow the transferred fat cells to settle properly and to prevent any damage or bleeding. The results of a Brazilian butt lift are long-lasting. Some of the transferred fat cells will be absorbed by the body initially, about 30 to 70%. It depends your surgeon technique and your lifestyle, as whatever you eat or not eat. And the remaining fat cells may shrink or expand over time due to weight changes, aging or other factors. There are a few key differences between the two. A Brazilian butt lift involves shifting fat from other areas of the body to the buttocks, while butt augmentation involves the placement of artificial implants. Recovery times also vary. A Brazilian butt lift usually requires about 2 weeks of downtime, while butt augmentation may require 4 to 6 weeks. Sleeping on your stomach is the best way to sleep while recovering from BBL surgery. But it's possible to sleep on your back by using pillows propped against your lower back. Propped against your lower back and thighs to take pressure off. There is nothing risky about pregnancy or having kids as long as you have fully recovered. A movement makeover can help improve the appearance of stretch marks on the stomach, but it will not completely eliminate them. During a tummy tuck procedure, excess skin and fat are removed and the remaining skin is tightened. This can help to smooth out and improve the appearance of stretch marks, but it not completely remove them. I take great care to place scars in such a way that they can be easily hidden by a swimsuit. However, sometimes stubborn fat and excess skin cannot be easily removed with diet and exercise. That is where the procedures come in. Typically, around 5 to 10 kg is removed depending on the patient's pre-surgical weight.